Hello and welcome to MedTech Practice Management. I'm Ginger Kuchbaugh, the founder of MedTech and the physician liaison here. I will be managing all your patient care and helping you with any of your patient needs. MedTech specializes in bioidentical hormone replacement therapy. What does that mean? That means we like to optimize your hormones to put you where you were in your peak of life, aka feeling like you're in your 20s again. And we have a variety of treatments we use to help achieve these goals. Obviously, working with hormones, we work with your sex hormones and we also work with growth hormone. We have amino acid injections, vitamin injections, medicated weight loss, sexual enhancement medications, and healing peptides. We even have facial creams that are prescription strength for getting rid of wrinkles and helping firm your skin. So, getting started with us as a patient with MedTech. You need to fill out your patient paperwork, which is done right off of our website. If we have manually entered you into our system, then we'll reach out through a text line. This is called the patient portal. This is where you will communicate with us any of your patient needs. We will send you a link to fill out your patient paperwork if you didn't come through online. This is also where you will ask any questions, set up appointments, all of that. There's a whole team of us that are willing to help you right through this line, and it goes directly into your medical file. It's also encrypted, so everything, all your information is all safe. Once your paperwork has been filled out, then we generally like to start with labs. We work with Quest Diagnostics, and we are covered in all 50 states for getting your labs done. For men, the fee is $95. For women, the fee is $115. And you can also provide us with your own labs through another provider, and you can email them directly to us so that we can upload them into your medical file. Once your labs have been completed, then we like to set up an evaluation by one of our physicians. We have a team of physicians and a team of compounding pharmacies that we work with. Once your evaluation from the physician has been completed via Zoom or telehealth, so you never have to leave the comfort of your chair or your home, then you will set up an appointment with me where we will discuss and go over a plan to help you reach all your options. So the doctor's going to let me know what you're a candidate for and if there's any health risks or concerns for any of the treatments. Then I'm going to call you and we're going to go over all the treatment options available for you and develop a plan, and then we'll come up with package pricing. The pricing can be based all up front, or we can come up with monthly payment options at no additional fee. I just know it's easier for some of you to pay month by month. Now that I've done your evaluation, ordered your medications, then we put it in the order right there at the compounding pharmacy, and it gets shipped directly to your door. I'm trying to make this as convenient as possible for you. So now that you have received your new package, this typically takes, to receive your package at your door, this typically takes anywhere from 4 to 7 business days. It takes anywhere from 2 to 3 days to process at the compounding pharmacy. Then the carrier picks up your treatment and they're responsible for tracking. So they'll send tracking information directly to your email, and we ship everything within 2 days. So this is anywhere between 3 to 7 business days you'll receive your package, and that's just business days. Weekends do not count. Now that you received it at your door, your timer has started on our end, and this is where we let you know when you need to follow up lab work according to your plan, or whenever you're due for refills. We also do check-ins. If you're a weight loss patient, then we like to do, depends on what your weight loss needs are, but sometimes I set them up for every 2 weeks, sometimes I set them up monthly. It just sort of depends on how our consult goes. So, just a basic rundown again of starting with us as a new patient. You're going to do your labs, unless you're just coming for healing peptides, or some weight loss don't require labs, but you should always get them done anyways, because sometimes hormonal imbalances can keep you from reaching your wellness goals. So labs, evaluation over the phone or via Zoom from one of our physicians, and then a consult with me, which is also scheduled. And then from there, everything gets shipped directly to your door. So we try to make this as convenient as possible. The only thing you should have to leave for is your labs. Reminders are set, so we're on top of it, keeping you up to date with your patient care, letting you know when you're due for refills, and we have pretty often check-ins to see how you're doing, because we want to make sure you're getting the most from your treatment. And this also helps if you want to add things on to your next refill order as well. think that pretty much covers it for what we do here at MedTech and how the patient process starts. So once again, when you get your treatment, tracking is provided directly by the carrier once it's been processed from the compounding pharmacy. So that's how you know you receive your package. Then after that, it takes 2 days to ship, and you should have it right there at your door. And then refills and reminders are scheduled by me, and I will be reaching out to you through the patient portal, where you can text us any day, anytime, day or night, with any of your questions or concerns. And if I feel like it's a long-winded answer, then I'll just go ahead and say, hey, this is a pretty long answer. Let's schedule a consult, so you and I can have a quick phone call to go over whatever your needs may be. So I hope this is helpful for you guys getting started with us, and I look forward to working with all of you.